We have the doc in the house now to talk about the different aspects of your health and to help you take better care of yourself. So USA Health is helping us out with that. So today, Dr. Richard Menger is here to talk specifically about spinal abnormalities. And you brought in a prop because we're talking specifically about multiple sclerosis.
Right. So, one of the types of spinal deformities is scoliosis. So that's a lateral curvature of the spine. There's also kyphosis, which is a bending forward, or lordosis. And all of those are within that spectrum of spinal deformity and different things that may or may not need surgical intervention.
Yeah. And I was talking with you just a few moments ago, before we came out for the interview. A friend of mine was diagnosed with multiple sclerosis when we were in grade school, and it was because of an exam that they did at the school.
Yeah. I think one of the hallmarks of scoliosis and adolescent idiopathic scoliosis in particular, early onset scoliosis, is catching it early.
Yeah.
And there's a lot of things that can be done that aren't surgery that really can help. And the earlier that we can catch that, the better. So a lot of times it's caught in school screenings like you referenced, or the concerned parent, pediatrician, that sort of as many people have eyes on the child as possible can help with an early diagnosis of that.
Okay, and so looking at this here, this is what it looks like, right, when a person has that spinal abnormality.
Yeah, exactly. So this is actually a 3D model that's reconstructed of a patient that had surgery performed, who has a specific type of kyphoscoliosis and a congenital component, which means something that they were born with. And this is one of the safety mechanisms we do, where we'll actually print a 3D reconstruction of the patient's actual anatomy and use that in surgery to help be as safe as possible. And it's a technique I learned from one of my mentors in fellowship. So.
And their treatment is possible, and this can be corrected.
Yeah, absolutely. I think most scoliosis, thankfully, is not something that needs a big surgery. We try very aggressively to be conservative with these patients. And if they need surgery, we've done a lot of advancements in the last 20 years as surgeons, and we try to do that as safely as possible. And there's lots of different ways that we're able to do that and help these patients. So.
And you get excited when you talk about this topic you were sharing with me earlier.
Yeah, it's a real passion of mine. It's my focus within spine surgery, is spine reconstructions and scoliosis and spinal deformity, and it's just an incredible impact that you can have on these patients' lives, and really blessed to be able to do that at USA, where we have the whole host of academic people that help us make sure our patients have good, safe outcomes.
Well, thank you. We appreciate you coming by.
Thank you so much.